Thank you, Dr. Jafar, for this very generous and for the advice for inviting me. Conference in its second version. I'll highlight being in the Transfusion Evidence Roundup initiative, and I will discuss some of high-quality evidence related to the donor. I hope my voice is clear for you. So, I will give an introduction about the Transfusion Evidence Roundup. It is a joint initiative between the International Society of Blood Transfusion, ISBT, and the Systematic Review Initiatives by the ISBT that was launched in September 2021. It has a quarterly newsletter curating top 10 papers on a particular topic to promote awareness of high-quality papers on that particular topic, address clinical and research questions of global importance, and facilitate learning and networking opportunities between ISBT members and the transfusion medicine community. So, the Systematic Review Initiative is a clinical group within the NHSBT. It's meant to increase the evidence base for practice in transfusion medicine and undertaking systematic reviews and it has two libraries, which is the Transfusion Evidence Library and the Stem Cell Evidence Library. You can subscribe to the mailing list and also follow their accounts on X. The overview of the roundup process takes up several steps. So the roundup team needs to select themes for the and the ISBT members and other transfusion medicine members can submit an application through their website to be part of the review panel. 3 ISBT members are selected for each round. Screening and review process takes from 6 to 8 weeks. The top 10 papers are being selected. The PICO summary is being created, and it is published in the websites. So how the themes are selected related to the mostly to the World Day. So we have the World Patient Safety Day, the World Hemophilia Day, and the World Thalassemia Day. They're of international relevance, current or topical. They are clinically important to transfusion community. So I was honored to be part of the reviewing panel with Dr. Karen from Norway and this is Jessica from Australia. So an overview of the review process for the high quality evidence related to the donor medicine evidence came up with 96 references. They were identified through PubMed Medline, Scopus, and 95 references were identified, 43 were systematic review, and 52 were RCTs. Then 32 abstracts were shortlisted. On round 2, 16 papers were fully reviewed. And then top 10 papers were identified for paper summary and a roundup for transfusion. So during round 1, the topics and the transfusion medicine were selected according to relevance to their topic, the inclusiveness. So they should be generalizable to most of the areas around the world. And of course, they should be advancing. They contribute to the improvement of the current practice. With round 2, we met through Zoom meeting. The abstracts were divided for according to the topic, and they were discussed individually, and the RCTs and systematic reviews were selected. There are some criteria for the selection. The clinical criteria for the clinical relevance was focused on the geographical setting. Is the study generalizable? Is it of clinical importance? Is it new or has interesting topic that can change the practice? And any important finding or new finding. The scoring system for the RCT was dependent on the sample size, as the RCT was well conducted and randomization was not subjected to bias, any missing data, and the statistical methods that were followed. And is it likely to change the practice in donor medicine? And was the trial registered at clinicaltrial.gov? The systematic reviews and meta-analysis, they have different assessment criteria. So was the literature that the systematic review has assessed recent? That means the data were retrieved within the 24 months. Does the quality of papers included evaluated? And did the systematic review include non-RCT data? And if that was disclosed and evaluated with a separate statistical analysis in that paper. The scores were out of 5, and following these scores, these top 10 papers were the top high quality papers in donor medicine featured for the World Blood Donor Day. The top article selected was the Iron Woman randomized or the Iron Woman trial, which is a high dose intravenous iron compared to oral iron in blood donors with iron deficiency, published in Clinical Nutrition. I will discuss this paper briefly later on. And there are several papers that have particular team that I will address later. You can see the paper summaries of these top 10 papers in the transfusion evidence library. So going back to the Iron Woman trial, it is a high-dose intravenous oral iron in blood donors with iron deficiency. That the healthy donors who were found to have low ferritin, that means a ferritin below 30 nanogram per ml, were randomized either to high-dose iron, which is 1,000 milligram per single dose, or 100 tablets of ferritin orally. And interestingly, the transferrin saturation and the ferritin were significantly higher in the intravenous group compared to the oral group. That's not interesting, but the interesting finding is the hemoglobin levels were comparable in both groups. The adverse effects and the serious adverse events were comparable in both groups. Moving to the second paper, which is donor deferral due to low hemoglobin. It was a systematic review that evaluated 116 studies. These studies were focused to evaluate the reason of deferral or the factors that would contribute to the deferrals due to low hemoglobin. Here I list the factors. The female donor were having a very high odds ratio of being deferred, 14.6. If we apply a universal hemoglobin threshold, and the odds ratio come down to 5.73 if we use a gender-specific threshold. The deferral due to low hemoglobin are associated with increasing age, especially in men, low body weight, shorter interdonation interval, being of Hispanic or African descent, higher ambient temperature. I think that's relevant to donors living in hot weather areas, especially in Saudi Arabia. Low ferritin levels. Also, that relates to the previous study of the importance of correcting iron levels in blood donors. Donation in fixed donor centers were associated with lower hemoglobin or deferral, higher deferral due to low hemoglobin. That is interesting finding, and that would support the MOH and Damy movement in creating more mobile donor centers actually away from the hospitals. There was conflicting evidence on the effect of new or repeat donors on the possibility of being deferred due to low hemoglobin. Also, some studies have studied if there is a relationship between the blood groups and the low hemoglobin, and there was no conclusion. The third study that I want to address today is a systematic review of intervention used to increase the blood donor compliance with the deferral criteria. This systematic review wants to address the possibility, or is there a difference in a donor disclosing sensitive behavioral information? And they were comparing computer-assisted self-interview compared to face-to-face interview, especially for, as I said, sensitive behavioral information, particularly related to intravenous drug use or HIV-related risk. And they found that the computer-assisted interview were more efficient when compared to face-to-face interview. And I think this study also supports the MOH movement to digitalize the questionnaire. Common themes of the high quality evidence that we studied is that most of the high quality evidence is supporting prevention of iron deficiency in blood donors. The studies also were focused on improving donor retention after deferral. The improving detection of sensitive behavioral information related to HIV and other viral transfusion transmitted diseases. Interestingly, there was no high quality evidence that would support the concept of health benefits to the donor, and that I think is of particular importance, especially when disclosing the benefits of donation to the public, not to probably put less emphasis on the health benefits of information of blood donation because this was not yet proven in a high quality evidence. So if you're interested to be part of this panel, you can sign up to this review initiative through the ISBT website or drop an email to science@isbtweb.org. And at the end, I would like to thank the ISBT SRI panel for involving me in that very interesting experience. And thank you for listening. I hope you enjoyed the talk, and you can ask if you have any question through you can ask me through the Q&A panel or connect to me through the email or text. And thank you.